The Department of Justice today reclassified state-licensed medicinal marijuana from a Schedule I drug to a less strictly regulated Schedule III drug. Here in Texas, only people with qualified medical conditions can buy and consume medicinal marijuana through the state's compassionate use program. But the DOJ's actions could make it easier to research the health effects of marijuana. Capitol reporter Dylan McKim spoke with one researcher in Dallas.
Dr. Francesca Filbey is studying the effects of cannabis on the brain at the University of Texas at Dallas. Just this year, she's published 3 different studies.
Not just whether you use or not, but whether it leads to problems.
In her years of research, cannabis has been a Schedule I drug, meaning it was not considered to have any accepted medical use. That created barriers. Studying a Schedule I drug requires a DEA license, various safety measures, and cumbersome reporting.
Only few of researchers can actually do it because they have to be from an institution who can support whatever the policies and regulations are.
But on Thursday, the Trump administration took a huge step to reclassify cannabis to a Schedule III drug. Dr. Filbey says that will loosen some restrictions.
A much more diverse area of research with more scientists engaged in that type of research.
Currently, Texas is expanding its medical marijuana program to provide better access to qualifying Texans. One of the suppliers in the program celebrated the change.
We have a lot of patients right now in the teacup that straddle the line between federal illegality and state legality. This order now ends that.
But the Trump administration faces pushback.
It's about politics, not science.
Kevin Sabet was the White House drug policy advisor for 3 presidents. He supports more research into cannabis, but worries about negative impacts.
We're opening this up to transnational criminal groups. We are opening this up to big business making money and marketing. It's big tobacco 2.0.
Back at UT Dallas, Dr. Filbey said more studies will need to look at the dosage of marijuana.
You've got prescribers who don't really have clear guidance on how to prescribe because those studies are very limited.
In Austin, I'm Dylan McKim.
And today's move only applies to medical marijuana. The DEA will hold hearings in June to consider the classification for recreational marijuana.